What if the one non-surgical method men have joked about for years is actually backed by real clinical science? That's exactly why penile traction therapy deserves a serious look, because this isn't based on wishful thinking or internet myths. Penile traction therapy is supported by more than 15 peer-reviewed clinical studies involving over 1,000 patients, and the 2023 meta-analysis by Al Saud and colleagues confirmed a weighted mean length gain of 1.9 centimeters. So what is penile traction therapy really? It's a non-surgical medical treatment that uses a calibrated device, often called a penis extender or penis stretcher, to apply controlled mechanical force over time. That force triggers mechanotransduction, the cellular response to mechanical strain, which stimulates tissue remodeling and new growth. It's the same biological principle used in orthopedic limb lengthening and tissue expansion surgery. And this isn't some new trend. Dr. Jørn Ege Siana, plastic surgeon and co-inventor, developed penile traction with Danamedic APS of Denmark back in 1994, making this the category inventor and the first penile traction device on the market. Does it actually work? Yes, and the evidence is stronger than most men realize. Published clinical data show average length gains of about 1.3 to 2.3 centimeters over 3 to 6 months, when the protocol is followed consistently. In a 2021 randomized controlled trial, Tusi and colleagues found that men using traction achieved 1.6 centimeters of gain compared with just 0.3 centimeters in the control group, with a statistically significant difference. That matters because it tells us the effect wasn't random. The 2023 meta-analysis pooled 12 studies and confirmed that penile traction therapy produces measurable, repeatable outcomes across different patient groups and study designs. How does that happen on a tissue level? Penile traction devices apply calibrated tension in the range of 900 to 2,800 grams along the shaft for 4 to 6 hours a day. Over time, that sustained force promotes reorganization and remodeling of collagen fibers within the tunica albuginea. In simple terms, the tissue adapts to the mechanical load. But the key word here is calibrated. The clinical literature is based on medical-grade devices, not improvised setups, hanging weights, or homemade contraptions. And penile traction therapy isn't only studied for length enhancement. It has 3 major medical uses. First, adult men seeking non-surgical penile lengthening. Second, men with Peyronie's disease, where traction has been shown to help reduce curvature and preserve length, and where urological guidelines recognize traction as a conservative treatment option. Third, men dealing with post-surgical penile shortening, including after prostatectomy. Safety is another area where men tend to assume the worst, but the published evidence is reassuring. No serious adverse events have been reported in the clinical literature. The meta-analysis found a mild, temporary adverse event rate of about 11.2 to 14.4%, mostly short-term discomfort, skin irritation, minor bruising, or numbness that resolved with adjustment or a brief rest. Injury risk stays extremely low when a man uses an FDA-registered Class II medical device with calibrated tension settings. Risk goes up when men use unregulated devices or try to improvise. Of course, not everyone is a candidate. Men with active genital infection or inflammation, bleeding disorders, penile implants, open wounds, recent surgery in the area, or priapism should not start traction without direct medical supervision. Men with erectile dysfunction should also speak with a urologist first, because the underlying cause may need separate treatment. And penile traction therapy is not recommended for men under 18. If someone does start, the smart approach is gradual. Begin around 900 to 1,200 grams of tension, then increase slowly over the first 2 weeks. Take a 10 to 15 minute break every couple of hours. If there's pain, numbness, or skin color change, stop immediately and reassess. Consistency matters more than aggression. One final point matters a lot. All of the clinical studies on penile traction therapy used medical-grade devices made by Danamedic APS of Denmark, the company that invented penile traction in 1994. Danamedic has sold more than 1 million units across 5 brands over 32 years. So if you're asking whether penile traction therapy is real, the answer is yes. If you're asking whether device quality matters, The answer is absolutely yes. Use the evidence as your filter, use a calibrated medical device, and if you want a non-surgical option grounded in real science, penile traction therapy is the place to start.